our webinar on buying and selling medical practices in Ontario. Now, this is an interesting topic as this is something quite new to the marketplace that we really have been seeing, give or take, for about a year and maybe year and a half now. And we're really trying to get both the buyers and sellers to think differently when it comes to their medical practice. For many years now, there were practices that were being given away, and years ago, practices were being sold. So it's something a little bit new. So we'll go ahead and get started going through everything. I do want to mention today that we will be recording the webinar, so if you do have to leave for whatever reason, patient comes calling or whatever it is, or you have a colleague that's interested, maybe they're looking to retire or sell their practice or buy a practice, then we're happy to send that on to them as well. So quick agenda for today. We're going to talk about obviously buying and selling or starting, the transition process, what you need to do to protect yourself, making sure that you're asking the right questions both from a buyer's and seller's perspective, and what is your practice actually worth. So we do have a few new people here, which is great to see. We're always happy to have new physicians or staff join us. So just a little bit about CIRRUS. We're headquartered in Toronto. We have two major components to our business. The first is dental and medical lease negotiations, which we do well over 500 per year, and the healthcare consulting division, where we provide optimization and income optimization for overall practices, both on the individual and group level, and most recently, practice transition assistance as well. So the purpose of today's program is to give you an understanding of the buying and selling market for Ontario practices, and to give you a clear picture of how to go about it. What do you do? What should you ask? What should you not ask? Who should you get to help you? And so on. So again, if you do have questions, please hold them till the end. I will have my contact details provided, so if you have questions, I would be more than happy to jump on a call, or you can send me an email. So why should you buy a practice? Now, for those that are a little bit on the younger side or looking to transition, maybe you guys are still practicing fee-for-service or in a family health group or whatever it is, and you want to get into a FO, you're looking at guaranteed income. You're buying a roster of patients that provides guaranteed income from day one. So you transfer a roster from somebody else, and from day one, you're making money. If you have a 2,000 patient roster, on average you're at $200 a patient. That's $400,000 a year of guaranteed income. Who wouldn't want that? You're saving your time, you're saving your money, and most of all, the stress of trying to build a practice. For those that are a little bit older in the room, you guys know it was a struggle back in the day, in some cases, to build up a practice to the level that you're at today. It could have taken 2, 3, maybe even 4 or 5 years in order to get to 1,500, 2,000 patients, or however many you're at today. Whereas now, we're providing the guidance in order to get to that stage from day one. So today you buy a practice, tomorrow you open it up, and you have those patients that are there already. You have hopefully a loyal patient base that will continue to come to you and earn you money each and every day. Starting from scratch is still possible, and there's definitely a lot of physicians that do it, but it's time-consuming. It costs you a ton of money. It's hard work, and it can be extremely stressful. If you open up a practice at the corner of, let's say Yonge and Eglinton, there's not a lot of unattached patients anymore in this area because there's a ton of doctors up and down Yonge Street. Yes, there's a lot of building going on, a lot of people moving to the city, but there are a ton of doctors in the area. So you putting up a sign, you may get 50 patients on day one, but who knows what you're going to get on day 2, month 2, month 5, month 12, you don't know. So having that ability to have the patients from day one is a tremendous opportunity. So it's really about where your goals are. Should you buy? Should you start? The idea here is if you have the financial ability or the financial foresight and foresight in general about what it means to buy a practice today and what it means for your future, it makes sense from a business perspective. As I said, you're going to save money. By buying an existing practice, you don't have to build out your own. If you take a blank slate, you got to build it. You got to create your rooms. You got to create your office. You got to buy all the materials, all the furniture, everything that goes into it. That's not something, I mean, maybe you're interested in that. Maybe you want to do that. Great, no problem. You know, all the power to you. But most physicians don't want to do that. Most people don't want to go through that long journey of finding a space, building a space, and starting a practice. Transferring a lease, again, we offer lease negotiation, so what we can do is help the outgoing physician negotiate that lease, negotiate the terms that are currently there in order to transfer it to you, or just negotiate a brand new lease with you. If the physician is coming to the end of their term and you're going to be starting a new term with them, let us help you negotiate favorable terms that will help you financially and just an overall favorable lease for your future from the start. As I said, could take years to build up a practice to a decent size. The average in Ontario is probably about 1,500. I think it might be slipping a little bit. We're seeing more and more of our physicians go on the smaller side because they want to have a better work-life balance. They want to entertain other options in medicine. They want to do things externally from their office. So that is slipping a little bit, but you need a good size roster in order to maintain a good amount of income. Staffing issues, leasing issues. Again, if you're taking over a practice, you have the staff that's there. Again, 9 times out of 10, they're going to want to stay, and 10 times out of 10, you're going to want them to stay because they know the practice. The added benefit of having a staff transfer from the existing physician to you is you can't even put a number on that because there is so much that staff will know about the practice, about the staff, about the patients. They're gonna be that stronghold for you to keep those patients coming back to you and keeping your office running in an efficient manner. And the lease. Lease is an extremely important aspect of any business, and especially a medical business, because you want to safeguard yourself. You want to protect yourself. You don't want your landlord coming to you and saying, "Oh, I'm giving you 30 days, 60 days, 90 days notice that you have to vacate because I'm selling the building, or I'm selling this, or I want somebody else that's going to come in and pay me more." You don't want that. You want to protect yourself as best as possible, and that's what we're here to do. So on the flip side, transitioning out of practice, why should someone sell? First and foremost, you have spent years and years building up a reputable practice, a profitable practice. You have spent countless hours working on making sure that you have the right staff, making sure that you have the right patients, making sure that you're billing the right codes, making sure that everything is running as smoothly as possible because that's your business. And you should get compensated for that if you're looking to sell it. You know, the location has value. The fact that you have quote-unquote trained patients has value. The staff, the relationship with the landlord. You know, if you've been in practice for 30-plus years in the same location, that landlord, chances are they want to keep you or somebody else in that space. They want another physician to come in and take over, and they're going to do whatever they need to do in order to accommodate you and the potential new physician to make sure that that continues, to continue for another 30-plus years so they know there isn't going to be a vacancy. Supply and demand. Since the ministry put the restrictions on physicians joining FOs, aside from underserviced areas, the demand has been there. There are physicians that are either moving to the province or graduating or whatever the case may be, and they really want to be in a FO model because they want that work-life balance. Maybe they are, again, pursuing other interests out of the practice. Maybe they're starting a family. Maybe they are, you know, who knows what they're doing, but they want to have that balance. They want to be able to work around their schedule but still get paid for the patients that they're responsible for and see the ones that are medically necessary and not waste their time in a walk-in clinic seeing patients that don't actually need to be there. So that whole supply and demand factor is really prevalent right now in the medical field where there's a ton of demand for faux practices, but not that much supply. But as these, you know, baby boomers and people in their later years of their career are starting to think about it, they're thinking, hey, you know what, if I could get $100 or $200 or even $300,000 out of my practice today, why not? Maybe I will retire a little bit earlier than expected. So So how do you put a value on your practice? This is a very good question. And, aside from looking at the obvious, the RAs, the financial statements, and other important documents, we really need to look at the practice as a whole. In some businesses, you're looking purely at the numbers. In others, you're looking purely at the location. In this, it's a combination. And you're also looking at the patients, the charts, the demographics. If there's patients that are on pain medication that or drug seekers, that's going to impact the value of your practice as well. For some, some are going to say, yeah, you know what, I'm very interested in that. I'm happy to take that kind of practice over. But others are going to say, no, I want to stay clear of that. Depending on what the incoming physician is looking for is going to determine what their value is to them. But from your perspective on the seller side, we want to look at the hard numbers and look at the practice in general and come up with a valuable number. Now, from my perspective, we typically like to use the 6-month rule. So we use 6 months of income because the ministry is guaranteeing that income for 6 months when a physician takes over. So if I take over Dr. Smith's practice tomorrow, I'm guaranteed to get paid as Dr. Smith for the first 6 months. During that time, I need to re-roster all my patients, all of the patients that were transferred, and after 6 months, any patients that I have not re-rostered will fall off, and then I'm paid as if it were me working and nothing else has changed. So the patient charts are very valuable. If you have an EMR, that's extremely valuable. We've had a few practices sell recently that didn't have EMR, so we dropped the price, or once we started negotiating, we're saying, what, we'll take $20,000, $30,000 off the price because we know that's what it's potentially going to cost you to implement an EMR, and that's fair. As you can see, be prepared to negotiate. This is a negotiation like any other sale, like a house sale or a car sale, whatever the case may be. You're going to negotiate. You're going to come up with an asking price of $150,000, and the buyer's going to come in and say, well, you know what, for A, B, and C reasons, I'm going to offer you $100,000. And then you go back and forth and meet at a happy medium. Or they're going to offer full price, or they're going to offer you a price that you're comfortable with. So just be prepared to negotiate. So the process. For buyers, you have to protect yourself. You want to ask the right questions. As I said, what kind of patients are you buying? Older, younger, very sick, not so sick, a lot of diabetics, not a lot of diabetics, drug seekers, non-drug seekers. There's so many variables that go into that. You just have to ask as many questions as possible. Get to know the outgoing physician as best as possible in order to build that relationship, come in ahead of time, see some of the patients, get to know the staff, get to know the practice as a whole, and see what you're getting yourself into. From a staffing perspective, as I said earlier, you want to keep the staff if you can. They are going to be that stronghold that's going to keep your practice together, keep the patients coming back, keep you running in the right direction. Because if you all of a sudden have existing patients, new staff, everyone's learning, it's going to take a long time. It's going to take a lot more time and effort in order to do that. Maybe you only want that existing staff for a year. That's okay. Create a contract with them and have them stay on for a year. Maybe have them help train someone new. Maybe they don't even want to stay themselves. Maybe they're planning to retire as well. So there's so many variables that go into each and every single practice, but we're here to assist you in making sure that you're asking the right questions, doing the right thing that works for you and for the sellers. From a seller's perspective, what are you going to include in the practice sale? The furniture, the equipment, the charts, the computers, artwork on the wall. Who knows what you want to include? Maybe you have a financial stake or a partnership stake in the building or the entire practice as a whole. Are you giving that up? We've had situations where the exiting doctor owns a portion of the building but wanted to retain that, or they've owned a portion of the clinic as a whole and they've wanted to retain that. So the new person coming in comes in as an associate and pays their 20-30% overhead, whatever the case may be, and that's it. They come in, they do their work, they go home, no questions asked, and everyone's happy. So again, there's so many variables that come into play that each and every single one of your practices is going to have a different subset of requirements, of things that you're going to have to go through, that there's no blanket answer. each one of you can give me a call. We can discuss. We can move forward. We can help you find the right physician. We can help you with the process of transitioning out of your medical practice. Purchase and sale agreements. So again, we have a sort of blanket purchase and sale agreement that we can use. We have many physicians that practices that we've sold that were very happy to use it. It's a very simple and straightforward agreement between the two parties. However, we've also had quite the opposite, the flip side, where there's physicians that are nervous or whatever you want to call it, but they want to have their lawyers look it over. And that's perfectly fine. We encourage that. We want everyone to feel comfortable. We want everyone to be protected. So it's up to you. Maybe as a buyer, you're going to have your lawyer and the seller's not, or vice versa. So, whatever the case may be, we're here to help and guide you and support you in any way possible. With regards to employment contracts, very important to speak to a lawyer about that. We're definitely not employment lawyers, but some physicians have employment agreements with their staff, and a lot don't. So it really depends on what your lawyer or what you feel comfortable doing moving forward. If you're taking over a practice and the staff that don't have employment agreements and you want to implement that, great. Go ahead. We highly encourage that as well. And some, just a handshake agreement is good to go, and everyone is happy and moves forward, and nothing really needs to change. So depending on the situation, we definitely encourage a lawyer to get involved at that point if that's the route you're going with employment agreements. But again, every practice is going to be different. From a financial standpoint, your accountant is going to be your best friend in this one. Tax sheltering, putting the money into your corporation from the proceeds of the sale, or taking money out of your corporation to pay for the sale of the practice, to buy a practice. You have to speak to your accountant to figure out what makes the most sense. Again, we're not tax experts, but we do have a little bit of a sense of what needs to be discussed or whatnot, so we definitely encourage you getting in touch with your accountant to find out what implications there are, again, from the buying and selling side. With regards to the Ministry of Health, so there's lots of agreements that are going to be put in place within your practice. So there's office agreements, the cost sharing, the partnership agreements, and the full governance. So a lot of groups have not only the Queen Majesty Agreement and the full governance agreement, but they have the cost sharing and partnership agreement. So there's potentially 3, 4, 5 different agreements that are going around your group. So from a seller's perspective, speak to the lead, see if there's any obligations that you have towards the group. Obviously, in most cases, you want to leave them on good standing, or if you're in a solo office and it doesn't impact them, then that's great. You don't have to worry about it. But some group governance agreements have voting requirements. So if there's a physician exiting and a new physician coming in, the group needs to vote on it. Again, if it's a group setting, a little bit more important. If it's a solo office, not as important. Notification with a departure notice. So those departure notices that you need to send into the ministry need about 60 days notice and working time from the ministry perspective. If you're in a CCM or a family health group today and you want to buy into a faux practice, you need to remove yourself from the CCM or fake practice, so you have to give yourself 60 days notice, and then you have to and then you submit the add-on application. So there's a potential for a 3, maybe 5 months of when you're not part of an enrollment model anymore and you're working fee-for-service. So there's a potential there for loss of income. We have a few situations of that coming up in the near future where there's a couple groups that are trying to have this, work it out, but there's a couple physicians that are going to have to remove themselves in order to get in, and they're going to lose out on a little bit of money. So things to keep in mind. Patient letters. So 60 to 90 days is really the sweet spot from a ministry perspective and even for ours. Again, you don't want to give too much notice because you don't want to run the risk of losing the patients for the incoming physician, but we encourage a joint letter, if you will, to state that, thank you very much for your years of patronage and whatnot. I'm leaving. Dr. Smith is coming in, and he or she has been practicing for X number of years. They graduated this school. Here's a picture of them. Here's what they like to do in their free time. Come in and meet them. The more you can give to the patients, the better off the new physician will be. And they trust you. They've been your sort of confidant for years now on the medical side, and who knows what else. And they trust you. If they've put their literally life in your hands, they're going to say, oh, my doctor said that this is a new good doctor. Great, I'm going to feel comfortable. I'm going to continue to come to here, because they're creatures of habit as well. If patients want to stay in the same location, if they've been coming to the same location for years because A, it's close to home or it's close to the office or whatever the case may be, they want to keep doing that. So any endorsement that you can give to the new physician would be fantastic. Some of the services that we offer, I know I've spoken a little bit briefly, just the fact that we're here to help in any way possible, but we provide individualized transition plans. And I keep saying that each and every one of you is going to have a different practice style. Everything is going to be different. There's no two practices that are alike. That's why we have to individualize the plan. We have to tailor-make the plan that works for you. We're going to provide you with an assessment. What is your practice worth? We're going to support you in the physician recruitment process. We're going to help you advertise. We're going to help sort of interview the physicians before they get to you, so you don't have to waste your time taking phone calls and emails of physicians that don't really know what they're doing or aren't really ready. Countless phone calls that I get are of physicians who are interested but aren't even close to ready to buy. And we don't want you guys to get bogged down with that. We're going to take care of that. We're going to take care of the paperwork. We're going to make sure that all the T's are crossed, all the I's are dotted before it goes into the ministry. We're going to support the lead physician in getting tracking numbers and making sure that all that happens as quickly as possible and as efficiently as possible. We can help you review your group governance agreement. Maybe you've never even read it before, which wouldn't be crazy, because there's a lot of physicians that really don't. There's no need for them to read it, but in this case there might be. We can do a quick analysis of your lease agreement to see if there are going to be any issues. If there are, then we can progress into our lease negotiation services and see what we can do on that front, and help you guide the patient and staff communications. When should you tell your staff? When should you tell your patients? What should you tell them? There's so many variables that go into it that really, the individualized transition plans is really where it stems from, and really gives us that guidance and being able to assist you in every way possible. So in summary, should you buy, should you sell? How do you value your practice? Making sure that you're consulting with your lawyers or accountants. And it can be a lengthy time process. There's a lot that goes into it. We're trying to find the right physician to take over your practice. In some cases, we're going to find them in a day or a week. And in some cases, it might take 6 months or a year. So if you're considering retirement in the next, let's call it year to 2 years or less, I would highly recommend reaching out, engaging with us to help you, to guide you, and support you in every way possible, because it can be a stressful situation. It can be a lengthy situation. And if you're looking to buy a practice, reach out. We definitely have some listed already for sale. We get calls all the time, so if you're looking for something very specific, if you're looking for a specific geographic location or roster size or faux group or whatever the case may be, we can help you with that as well. We can help match make the buyers and sellers and make sure that everyone comes out ahead and everyone is going down the right path to success on the buying side and on the selling side. So thank you very much for your time today. As I said, my contact details are here. I would be more than happy to schedule a call or answer any questions via email that you may have. If you're looking to buy, reach out. We have some practices available. And if you're looking to sell, reach out also. And we're happy to help list your practice and hopefully find you a great new physician to come in and take over your patients, because ultimately that's what we're here for. We're here to make sure that your patients are being taken care of, that your group is being taken care of, and that your staff are being taken care of, and that everyone goes home at the end of the day with a smile on their face. So thank you again for your time, and I hope you all have a great rest of the day.